Hi everyone, I'm one of the fifth year medical student and at Ternopil Medical University, Ukraine. So here, if you are new here, so please do subscribe the channel and please do like and share the video if you like it. And so today we are going to discuss about the uterine cancers. So what actually is uterine cancers? So basically it's the neoplasm or we can say tumor growth which is malignant in nature and has the tendency to invade to the other neighboring tissues, and it can also spread to the other parts outside the pelvic into the abdominal cavity, to the lungs, to the other organs because of the metastasis. So how we can diagnose this? First of all, the symptoms. If the patient is coming with the post-menopausal abnormal vaginal bleeding, then there can be the chance that the patient might have the hyperplasia of the endometrium, as the endometrium tumor is the most common kind of gynecological tumors. That is also a eighth leading cause of death in the in category of the tumors of the gynecological problems. So how we are gonna diagnose this tumors? So if the patient is coming with the postmenopausal vaginal bleeding, in 10% cases it's sure that it's hyperplasia of the endometrium, that is the tumor or carcinoma. But in 90% cases it's not the tumor. There can be also non-cancerous tumor which are linked to the vaginal bleeding after the menopause, post-menopause. So that reasons can be like polypoids or other infections like UTI can also cause the bleeding after the postmenopausal. So if there is a tumor present, there can be, if we talk about the endometrium 1, then there can be type 1 and type 2. The type 1 is basically the estrogen dependent. How this affects the lining of the endometrium? If there is an increase in the estrogen level comparing to the progesterone, then there will be the formation of, like, there will be the thickness of the endometrial lining, which ultimately can lead to the tumor growth. And which kind of patient are more prone to such type 1 carcinoma? If the patient is obese, first of all, then if the patient is taking pills for the breast cancer, because that pills, what are going to do? They are going to inhibit the secretion of the estrogen into the breast and let the secretion into the uterus, which can lead to the thickening of the uterine lining and ultimately tumor. Or if somebody is taking the postmenopausal estrogen therapy, as after postmenopausal situation or time or phase, some females feels like hot flashes, mood swings, or kind of dryness in the vagina, or itching or irritation in the vagina. These are some kind of postmenopausal symptoms, due to which some females take estrogen therapy to get relief from that kind of symptoms. But as usual, everything has its side effects. So that postmenopausal therapy which women is taking, estrogen therapy, has its side effects, like it can cause the formation of the carcinoma type 1, which is estrogen dependent. Or if the female is like around 55 to 65 years, they are more prone of getting this type 1 kind of carcinoma. And if we talk about the type 2 endometrial carcinoma, that is independent of the estrogen levels, and it occurs in the females who are lower in weight. And this basically occur in the female in which there is an atrophy of the endometrium. So, and this is more common in the African descents. So we diagnose basically this kind of tumors via, we can use transvaginal ultrasonography, in which we look after the uterine lining, the thickness of the uterine lining. If the thickness, or we can say stripe, is less than 4 mm, then the possibility of occurring of the endometrial carcinoma is less than 5.5%. But if the lining or the stripe is more than 4 mm, then the possibility of occurring of the endometrial cancer is much, much, much higher. But in some cases, the endometrial lining is thin, not thick, it's thin. But in the patient with the atrophy, type 2, so we have to do the tissue biopsy, that is endometrial biopsy, to confirm the diagnosis. So after tissue biopsy, we come to the conclusion that yes, the patient is like having cancer or non-cancer. So yeah, and for the treatment, we basically do the combination treatment we give, in which we can use the radiotherapy, chemotherapy, and after all, surgery. Surgery is very important in such kind of tumors because we have to remove the tumor, of course. So for the surgery part, we actually perform two kind of surgery, because the reason behind is that the staging process for these tumors is like that. In stage 1, the tumor remains within the uterus. In stage 2, the tumor starts spreading to the cervix. In stage 3, the tumor starts spreading to the neighboring lymph nodes, neighboring tissues, like vagina, upper part of vagina, cervix, and all such areas nearby the uterus. And in stage 4, because of the metastasis, the tumor starts spreading to outside the pelvic area to the other abdominal organs. So in the treatment part, even because of this metastasis part, the symptoms varies. Because if there is a stage 3 or stage 4, that is, when the tumor starts spreading to other parts of the body, then the symptoms will of course vary. Because if there is a spread of the tumor into the abdomen, then there will be the abdominal symptoms like bloating or pain in the abdomen area and such like that. Other symptoms can also be present like purulent genital discharge, pain, such like that, and pelvic discomfort too. So for the treatment one, we actually, the treatment depends upon how the patient wants. We have to ask for the patient whether, because in surgery we actually remove the uterus, that is hysterectomy, and for that purpose, for that procedure, the patient should agree on that, because when we remove the uterus or we do the hysterectomy, the patient will get infertile for the whole of his life. So it is very important to ask for the patient and to tell the patient about the consequences about the surgeries, and then we perform the surgery. So treatment depends upon the preference of the patient, how he wants or how she wants. So we can do the hysterectomy, in which we remove the uterus simply, and we can do the oophorectomy, in which we also remove the ovary, that is salpingo-oophorectomy, ovary as well as uterus, and we can do the lymphadenectomy, in which we remove the lymph nodes which are affected because of the uterine cancer. And some patient might need chemotherapy and radiotherapy after these kind of surgeries itself. So yeah, that's all. Do tell me how you like the video and share if you like it. Thank you.